Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss epilepsy in healthcare, what quality of care is, seeking care, surveys, the cost of healthcare when having epilepsy, challenges in obtaining care, and goals to improve care. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. We appreciate your support. Despite epilepsy being the fourth most common neurological disorder, many patients experience delays in diagnosis, lengthy referral times, complications with medication, and lack of management due to the layout of the healthcare system. Finding affordable and convenient access to healthcare while battling epilepsy is essential. According to the Epilepsy Foundation, approximately 30 to 40% of individuals with treatable epilepsy live with uncontrolled seizures. While significant progress has been made to improve the quality and access of epilepsy care, better seizure medications, and surgical techniques, more must be done to improve care for those battling epilepsy. According to the U.S. Department of Health and Human Services, healthcare quality is a broad term that encompasses many aspects of patient care. Quality healthcare is care that is safe, effective, patient-centered, timely, efficient, and equitable. Quality of care is important for patients with epilepsy. According to the Centers for Disease Control, around 3 million adults have been diagnosed with epilepsy and 470,000 children. Active epilepsy is defined as having a reported history of doctor-diagnosed epilepsy and are either taking medication to control it or have had one or more seizures in the past year. Epilepsy is often diagnosed by a doctor once someone has 2 or more unprovoked seizures. When someone has their first seizure, they often go to the emergency room or their healthcare provider to be referred to a neurologist or epileptologist. When seeking healthcare, things like age, location, insurance, presence of comorbidities, personal preferences, and social demographics are all taken into consideration. Seeking care for epilepsy is far from universal, but surveys have found some commonalities. A community-based survey found patients with epilepsy, 94% had consulted with a neurologist at some point of their diagnosis, and 62% had a neurologist as their primary physician. The survey found that the primary form of treatment for epilepsy is with anticonvulsant medication. 93% of patients were on medication and 55% had no seizures in the past 90 days. Current insurance coverage for patients with epilepsy is more limited, but in a 2011 study, patients with epilepsy were more likely to have public insurance. Although care for epileptic patients exist in the U.S. healthcare system, frustrations such as long appointment wait times, lack of access in rural or underserved areas, and lack of communication between providers are common. Past surveys have quantified the healthcare disparities existing among people with epilepsy. The 2010 and 2013 National Health Interview Survey compared adults reporting no history of epilepsy to those with active epilepsy, find that those with epilepsy experience significantly greater barriers to health. The survey calculated rate ratios to quantify these gaps in care, adjusting for sex, age, and race ethnicity, finding that those with epilepsy experience quantifiable real disparities. The study found that people with epilepsy have more of an inability to afford medication, mental health, eye and dental care, along with reported transportation barriers and inability to get appointments. The study also found that people with active epilepsy were significantly less likely to be employed and more likely to visit services for a mental health care provider and experience serious psychological distress. Having epilepsy can cause financial burden for many. A 2009 study on the 1996 to 2004 Medical Expenditure Panel surveys calculated that a person with epilepsy spends $4,523 more per year on medical expenses than someone without epilepsy. For patients with focal onset seizures, another U.S. survey claimed data found that patients battling focal seizures spend $7,190 more than those without focal onset seizures on healthcare costs. Patients battling focal onset seizures were found to have higher rates of mental health conditions, more migraines, other neurological disorders, and more comorbidities, resulting in additional costs. In addition, the 2009 study found that costs for seizure medication and direct epilepsy care were $3,290 per person on average. Today in 2021, it is much higher. In 2020, the Epilepsy Foundation of America conducted a 2020 survey on access to epilepsy care. The survey was based on major struggles among people with epilepsy. The survey found 59% of the participants reported challenges with health insurance. With insurance troubles, 42% reported paying too much, 29% reported paperwork was the biggest struggle, and 24% reported being denied a necessary treatment, service, or test. 45% of the participants reported challenges in seeing a neurologist or epileptologist, and 59% reporting long appointment wait times. 70% of the participants cited anti-seizure medication challenges like side effects, cost, and formulary switches. The National Institute of Health has an initiative to improve access to care for those with epilepsy, specifically those in populations with low socioeconomic status and in racial ethnic minority populations. In order to rectify these inequalities, the reasons they occur, the importance on overall health outcomes, and the magnitude of the issues in relation to larger societal care, gaps need to be understood. The model, which aims to improve access to health care services for people with epilepsy, has the following priorities: strengthen epilepsy care by primary care providers and have clear clinical pathways for referrals and more specific care. Promote a flexible and patient-centered care plan for epilepsy and comorbidities. Reach rural and underserved populations. Provide smooth transitions of care. Make health insurance coverage affordable and readily available. To learn more about healthcare and epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos on our channel and subscribe today. You have the power to defeat epilepsy.